Well, I am prescribing it to patients, but I am prescribing it first for the last year as a vaginal estrogen to help them with that. And I prescribed it for patients that are 60, 70, even 80 if they have a risk or concern about bladder infections. And now I'm asking patients to use the estrogen once a day, probably at bedtime because it is a heavier cream. It's very cost effective for them to use the one that is the vaginal estrogen, and to use their retinol and sunscreen in the morning.
Hi, Skin Friend. Thanks so much for tuning into this week's episode of The Skin Reel. I'm really excited to be continuing a discussion I had a couple weeks ago about menopause and hormone replacement therapy and all that good stuff with Dr. Kelly Casperson. And this week, I'm joined by my colleague, Dr. Brenda Dintiman. She is a board-certified dermatologist with over 30 years of clinical experience. And we are going to be taking a deep dive into the skin changes that happen for women in menopause and postmenopause, and what they can be doing at home as well as with their lifestyle. And then, of course, in-office procedures to really maximize their skin health during this phase of life in a group of women that are often forgotten about, which I'm glad people are finally talking about it and realizing their unique challenges, not just for our skin, but for our bodies during this period. Dr. Dintiman practices in Vienna, Virginia, and she is also the founder of Derm Utopia, which is a telemedicine platform that was telemedicine back before that was a thing. And she is always making sure to stay on the cutting edge of knowledge and skill and technology. If you are in menopause or beyond, or just wondering what is going to happen when you get there, then you are definitely going to want to check out this episode. Dr. Dintiman, thank you so much for being here. I'm so excited to talk about a topic that really I have become ever more interested in every year that moves forward for me in my life now that I'm in my mid 40s. So thank you so much for being here. So I feel like I'm hearing all the time, and probably you are as well. We're finally hearing about menopause, and maybe that's also just the things I've been listening to and hearing about. But I know certainly my patients come in and are asking about it, have questions about it. But have you seen an increase in menopausal women interested in their skin health?
Absolutely. I mean, we've always had patients interested in that, but I know some people are binge watching murder mysteries, but I'm binge watching menopause. I'm binge watching and listening to Rachel Rubin, to Dr. Kelly Casperin, and Dr. Laura Stryker. So I can't get enough of it. And I think it's been so helpful because every day a patient comes in and asks a question about the effect of hormones and menopause on their skin.
Oh, yeah, totally. And it's like we are so hungry and thirsty for this knowledge that we haven't had. And finally, people are talking about it. I have to say, when I was in med school, I don't remember talking about menopause at all. I mean, we learned a lot about reproduction and things like that. And then, then I'm having kids and I'm not thinking about being 50, 60 plus, right? But I feel like it's this forgotten group of women, this stage of life that's going to happen to all of us if we live long enough. And finally, it's being discussed.
Exactly. I've been in practice over 30 years, and I think I was part of what I call the lost generation because I was going through those times of taking care of patients right when all the hormones were removed, that patients were no longer being put on hormones. But I remember every single patient coming in on hormones in the 90s and the years 2000s, and some women that wouldn't go off of them. So it's really fun for me to really look back and think about what were the questions they were asking and what did we do and what did we tell patients? My philosophy is that we always have to be learning and relearning things. And that's why these greats that are talking to us about menopause are really affecting us.
Yeah, there was this decades worth of women who just were forgotten, right? My mom, they didn't get offered hormone replacement therapy. In fact, they were scared to death to even think about it. And that sentiment is still out there. But can you just break down, because hormones are very complex, right? And I hear people talk about get your hormones balanced, but really as a woman, you really can. Every month with our cycles, our hormones are not imbalanced. They're these normal, natural fluctuations. Can you just kind of give us a dermatologist perspective of what's going on with our hormones throughout a woman's life?
Well, I think you know, as a dermatologist, that we take care of patients with acne. And we always teach them that they can have acne breakouts not just before their periods, when their hormones are preparing for their menstrual cycle, but also mid cycle. So it's something we're very attuned to. And then as they go into their 20s and 30s, I've become very aware that they're either on birth control pills or they're going through more stress, but the hormones are still a part of their day-to-day skin changes, and then when they go into having children, then postpartum. And now I think the emphasis again is to look at what starts to happen perimenopausally. Definitely we see people getting acne. Definitely you can see hair loss. Definitely you can see skin texture and dryness changes. So the hormones are constantly a part of your day-to-day thought process as a dermatologist taking care of women patients and men too.
In menopause, I think most people have heard, right? Your estrogen essentially drops for women and you no longer produce estrogen. What about testosterone? Because you said women can get acne when they're menopausal, postmenopausal. And I think that surprises a lot of people because we were all hoping that, we said goodbye to acne when we were teenagers, right? But not so.
Yes, and I've been doing so much reading and research and going back to even the 1990s, reading the articles. And it's fascinating to me because, again, the things we always told patients was that as they went into perimenopause, the amount of estrogen went down and it seemed to be an imbalance or an overpredominance of their androgen hormones. And that seemed to be a great trigger in their acne. And that's the reason we also like using spironolactone because it seems to block those androgen receptors and improve people's acne. When I was taking care of patients with acne, we always used so many antibiotics, and now the number one drug is spironolactone.
That's amazing. I was really shocked to learn that dermatologists were the number one prescribers of antibiotics over infectious disease doctors. And we weren't even using it for actual infections. We were using it for acne. So I think we've come a long way in the last few decades understanding that and understanding really what's triggering acne and the best way to approach it. And yeah, spironolactone is a great prescription for that. What about hair loss? I am seeing so many women with hair loss, 40s, 50s, 60s, beyond. And I didn't really realize this was so prevalent in women until I started practicing dermatology. So, what's going on in the postmenopausal or even perimenopausal phase causing this?
That's a great question. All I know is I have never seen so much hair loss as I've seen in the last 5 years in my whole career. We always saw it. We didn't have a lot of good answers. I feel like finally we have some insight. I don't think it's all about the hormones. I've seen that. I think it's about whether the tank is full, whether you have enough vitamins. I see a big correlation to not enough vitamin D, to low ferritin. We talk about the thyroid, but I would say not as many people do I see changes in hair loss. You can have hair loss from low thyroid and high thyroid function. But I see it more that it has to do with filling the tank with the right nutrients, getting enough protein, and then making sure the scalp looks healthy. So those seem to be the major components. The hormonal part of it is very interesting. Over the years, I would see women coming in, they were still on hormone replacement and they had extensive hair loss. Now, at that time, we were not giving people testosterone. They were getting oral estrogen, oral Provera, but I don't think it's totally correlated to hormones. Just like we see women that acne completely clears when they're pregnant and other people have extensive acne. So I think that it's more complex.
I would agree, right? Hair loss is super, super complex. I do feel like the hair is really sensitive to fluctuations with stress, right? We know telogen and effluvium, your hair falls out. And we know that some people are more susceptible to testosterone like DHT than others. So I think it's complicated. It's not like a clear thing. Yep, it's this is what's causing it. But I do feel like I'm seeing women, more and more women on testosterone. Are you seeing that in your practice?
I'm seeing a few. I would say not so many yet. Some are on testosterone creams. And definitely we're seeing more patients come in that are getting hormone replacement. What I'm seeing is 4 out of 5 of the patients that just started hormone replacement had new acne. And I thought that was very curious. And my thoughts on that, again, after reading, is that I think that it could be that estrogen can be helpful to not have as much sebum, but also I think it's not balanced. The word balance is more that maybe there's just starting off on a low patch of estrogen and they have their progesterone, and maybe they need more estrogen. Definitely, we're going to see more acne, in my feeling, in people that are on testosterone, depending on the level.
As far as I know, there's no female dosed testosterone, right? So it's a little bit of trial and error to try to get the right amount. And I was dumbfounded by this. Women have more testosterone in our bodies normally, naturally, than estrogen, which I couldn't believe. It's just that we have way less than men. So trying to use sort of like a male dose testosterone and make it for women can still be higher levels than you need. And then you see those side effects again with the acne. That's usually what I see. And then sometimes some hair loss too. So it's a balancing act, right? Because if you need the testosterone for libido, energy, muscle mass, stuff like that, you have to kind of weigh the pros and cons, right?
Exactly. And the spironolactone is really good for the oily skin, oily hair, acne, and the female pattern hair loss. But as everything, it can have some side effects. What I found is very minimal, but they can get vaginal dryness. So you have to be balancing a lot of these medications that you're giving patients. But I think those of us that are super excited about it, we're going to work through those situations. Just like one person can use Retin-A and use it every day, tretinoin, for anti-aging and acne, not have any dryness. Someone else might only be able to use it twice a week. And I think the same situation occurs with hormones. We have to listen to the patient and listen to their symptoms.
Yeah, hormones are so powerful, right? I think we sometimes underestimate them. Like, why am I so emotional today? Or after having my kids, I'm crying, leaving the hospital. It's just like my hormones just, hit me all at once. One of the things I love about spironolactone is that I'm seeing a lot of patients, and I'm prescribing a lot of minoxidil, right? A lot of medications for hair loss, like dutasteride, things like that, in postmenopausal women. And one of the main side effects for those is that you can get more of that peach fuzz or even dark hairs on the upper lip, the chin. And I find spironolactone can be helpful in preventing that. Do you use it in that way too?
Yes, I think you're right. We can see that we're getting great hair growth with minoxidil pills on the lower dose, but some women will start to get more hair growth on the face, and then you could use the spironolactone with it. I'm also seeing women getting more peach fuzz with their hormone replacement. So I'm really curious about that because they're not on testosterone. And, that all leads to this whole excitement about estrogen cream and whether we should use it on our face.
Yes, absolutely. Well, let's go there, right? I was just talking about it with a patient today who was in her 60s talking about really dry skin. So, what's the deal with estrogen cream?
Well, I think that there's a lot to be studied, but I was such a skeptic, and anyone will tell you that. I was like, oh no, don't just start putting that on your face. Make sure you're wearing your sunscreen first. That's your best anti aging cream. And then I started delving in and also listened to Dr. Lars Stryker's podcast. And I love the story about how estrogen creams were around in the 40s and how they were around in the 40s. They were in Helena Rubinstein's cream and Elizabeth Arden, and they were the wrinkle cream and very effective for making the skin more moist and apparently making the collagen look better. Then they got taken off in this way in the 60s and completely gone in the 90s. And now here they're resurfacing. So I think the thing we're going to have to figure out is, are we going to not mind using the same vaginal estrogen cream that we use on the vulva, on the face, or are we going to want something a little bit more elegant? I think like other products, and in dermatology, it's all about the base that it's in. We have to be sensitive to the estrogen cream, the generic, has propylene glycol in it. So maybe people won't be able to use that. It has parabens, although parabens are not a big problem. But we may have to recompound some of those products to make them a little bit lighter and less plugging of the skin, and so that we can use them.
I feel like women have been probably using their vaginal estrogen cream on their face and their skin. The feel of the product is key, right? I tell my patients too, they say, what's the best moisturizer? What's the best sunscreen? I'm like, the best one is the one you like how it feels. I cannot stand thick stuff on my face. I don't like putting a lot of things on my skin. So I'm pretty sensitive to that. So I would want something really, really light, but also moisturizing. And the other thing I think that women don't necessarily want to be putting that cream maybe in their medicine cabinet or out on the counter where other people see it perhaps. And so I think making it specifically for the skin of the face or the neck, I think could be nice, especially if it has a nice feel for it. So I think it's all about the feel, the texture. We know it works. We know it can be helpful. We know our skin cells have estrogen receptors on them. So it just makes sense that if it works for the skin of the vulva, perineum, then it would also be helpful on face skin, neck skin, hand skin, all of that.
Yes, and it looks like after about a month, some of the studies show that you see a little bit more moisture and the integrity of the skin looks better. It's going to take 2, 3, 4 months to start seeing collagen changes. And, the studies will be a little difficult to do because a lot of patients are also on progesterone. And topical progesterone can also improve collagen. So I think there's a lot to unpack there about how we're going to use estrogen and incorporate it into our many products that we have in dermatology.
Yeah. And are you prescribing it for patients? And where do you think it fits in the skincare order of things?
Well, I am prescribing it to patients, but I am prescribing it first for the last year as a vaginal estrogen to help them with that. And I prescribed it for patients that are 60, 70, even 80 if they have a risk or concern about bladder infections. And now I'm asking patients to use the estrogen once a day, probably at bedtime because it is a heavier cream. It's very cost effective for them to use the one that is the vaginal estrogen, and to use their retinol and sunscreen in the morning.
Right. I tell them kind of think of it as your moisturizer, right? Like that's really what it can replace. And if you love your morning moisturizer, keep using that. Or, you can switch it up. I'm less particular on whether you use it morning or night. But yeah, if it is a thicker formulation, then you may want to do that at night. You can do it after your tretinoin because we know that can be drying too. But yeah, I think it's really neat and we'll be seeing more about it. I hear people asking me about it for it. Where can I use it? Right? You can use it on any skin of your body, right? And here's one thing. Do you ever have people worried about systemic absorption with their topical estrogen cream?
Sure, absolutely. It's going to be hard to get rid of the research that has been discounted from 2002, 2004. But at least we've learned from the researchers that there's very little absorption in the mucosa, in the vaginal area. So there's going to be even less on the skin. So I think that's the main thing that we have to really educate patients and alleviate their fears. There is some concern that it makes melasma worse, the pigmentation, just like when you take a birth control pill. I've seen some people say that that's going to happen more when you apply it to the face, not as much to the neck, and that you may have to be extremely diligent about using something like a hydroquinone or a lightening cream to protect your pigment cells if you're already prone to pigmentation.
Right. Yeah. I think mostly anecdotal, but sure, it makes sense that estrogen can worsen melasma. So if that is something you really struggle with, the topical estrogen wouldn't be a first line option for you. But again, you could always try it or do a test area and see first. But I do think it's important for people listening to know that, well, we know it's not that it seems, we know that the topical vaginal estrogen is not systemically absorbed and the skin of the rest of our body is keratinized. So even less likely that it's going to be absorbed. And I've also heard people ask, is it safe to be on topical estrogen if they're also on like the hormone replacement patch? And yeah, you can be on both of those, no problem.
That's right. That's what we've learned.
I still think there's so much misinformation out there. Maybe it feels like, oh, everyone knows this because we sort of follow the people. The women who are leading the way in menopause and health. But then I see my patients or I talk to someone, I realize, wow, we still have so far to go, don't we?
Yes, and it's not unusual for a patient to come back in for their visit and say that they actually picked up their vaginal estrogen but never used it. And today I took the time to actually pull the insert out, and you can see why. Because all the very scary side effects are in there from that probably will need to be altered over the years. I think there's a lot of research that still needs to be done, and it's going to be a little hard, like I said, to research it because you've got to tease out, you're going to get some improvement being on your patch too in your skin and the progesterone. So it's going to be teased out whether it's actually the cream doing it. But I think it's fascinating that estrogen cream was around in the 40s and then it was taken away, and I can still remember my patients saying, "I'm never going off my hormone." And they were right.
Yeah, it'll be interesting to follow the women now who are on it and follow them for decades and see. I think it's important to know too, like this isn't like the magic pill to solve aging, right? Like it's not going to make you not age or ever get wrinkles or any of that. But we do just know that estrogen is so important for so many organ systems, not just our skin, not just your GYN organs, brain, heart, everything. So I'm just excited that this group of women is no longer being forgotten and we're actually like valuing women 50 plus, which the crazy thing is, the future, my children may live longer in postmenopause than before. It's kind of crazy to think.
Yeah, and this is the generation that not only has access to topical estrogen, but has sunscreen and has access to wonderful lasers and microneedling and other things that stimulate collagen because it's never going to be a one step. Just like in weight loss, it's not just about the weight loss drug, it's not just about eating your protein, and it's the same thing with your skin. So you and I both know that there's some amazing other tools. People can use their day-to-day products, their day-to-day protection, but every so often you need to step it up to reach the goals that you want with your skin.
Yeah, well, let's talk about that, right? So, what are sort of the at home skincare 50 plus, menopause, postmenopausal? What are sort of the at home skincare things you recommend? And then we can talk about sort of the in office procedures that can be helpful.
Well, I'm kind of a minimalist, so maybe it's like you said, real skin. I'm into a gentle cleanser, a moisturizer that you love, and that's going to vary depending on whether you have combination skin or you're super dry. And I put my sunscreen on every day. I don't think about it like, is it going to be sunny today? And that's why I love a tinted sunscreen because I use it like a base, not too much. I don't really like to wear a lot of makeup. And then I repeat the same thing at night, except I include a retinol. Sometimes I'm able to use a prescription strength. Sometimes it's too strong for me. And I use a retinol cream that's a little bit more moist. I think starting simply with that is great. What about you?
Absolutely. I do that as well. I don't use tinted, I'm pretty pale. So, it's hard for me to find one that doesn't make me look a little bit, I don't know, like I have dirt on my face. But I'm like you, I'm a minimalist. I don't really struggle with hyperpigmentation, so I don't use a vitamin C, although I do think it's great for people who do struggle with that. And then one thing I've recently started doing that I really love, I found it really helps my skin stay hydrated, and I'm using the plated exosomes serum, and I am using that. So in the evening, I wash my face. I don't even wash my face in the morning. I just splash water on and sunscreen. And in the evening, I do wash my face. That's mandatory. I'll do my plated exosomes and then I put on my tretinoin and a moisturizer. And that's it. I really credit doing that consistently for decades for getting me to where I am with my skin now. I haven't done peels and lasers and anything like that up until this past year. And now I'm realizing, okay, now it's time to bank a little bit more by investing in some in-office procedures. So, what are those in-office procedures that can be helpful for people midlife and beyond?
Well, I think that definitely varies from physician to physician, but I love microneedling because it has minimal downtime. And we can use it for people with acne scars. We use it for people that have enlarged pores or just to freshen the skin. I love that if I have it done in 24 hours, the redness goes away. I can put up makeup, moisturizer, and go about my day. So very little social downtime.
What is microneedling?
Microneedling is like little fine channels that you're making from like 32 needles. It's not painful because we use numbing cream for about 45 minutes ahead. And then your body is stimulating your body to make new collagen.
I think sometimes it's underappreciated, but I've used it on scars and it does a great job. And it's a nice refresh. Again, low downtime, pretty safe for really any skin type because there's no heat involved. So, a great option for a little kind of monthly refresh, if you will.
Right. Yes, and I think, no office is gonna have every laser, so you have to kind of look at what problems you have, and we have an IPL that helps with a little bit of pigmentation and redness. We have, the Virtue radio frequency. I like that for tightening. I like, again, that it has almost no downtime and maybe 6, 8 hours of redness. And, I really think that there are a lot of lasers that are still stimulating collagen. The goal is kind of fractionated, minimal downtime.
Yeah, absolutely. I think at in this age group too, there is a good bit of sun damage for some people. And so evening out that complexion with either an IPL or a chemical peel or a resurfacing laser can make such a difference. It just makes everyone look more youthful, and again, it's you still look like you just look brighter, like you got to went on a great vacation. So I really think evening out the complexion is really like a game changer for people. And really, I think sort of like the must do before any of these other things, because it makes everything look better when your complexion is even and uniform.
I agree. And you mentioned peels, and I think peels are just back in. We used to do hundreds and hundreds of peels, and then it's like we forgot about them. And a lot of it really should be called treatments, pigmentation treatments. You really don't peel on the gentle. That to the extent of also doing the more stronger trichloroacetic acid peels are great for people that have a lot of sun damage. So it doesn't have to be a laser to work, but we have a lot of things in our toolbox.
Yeah. What about tightening? I mean, you kind of mentioned the RF microneedling devices. I feel like tightening is an area where there's a lot of interest. I'm sometimes disappointed in the results unless it's surgery. So, are there any that you really think are a game changer in that whole arena of body contouring, tightening, things like that?
Oh, I think it's challenging. I think tightening is the most challenging, and it's hard to tell your patient, but I think it's important to be honest that they probably need to see someone that can evaluate them for surgery. The tightening devices can only do so much. I think that it is sort of a quest to work with other people that have the same device as you do and to learn the best settings because it's not as obvious how to get the results you want. So I think my experience is the same as yours. Many people need surgery, and if they don't want it, then we just have to work with the concepts that we have.
Yeah, well, and I think also set realistic expectations that if they're coming in sort of pulling their jaws back and saying they want microneedling to do that, they're going to be really, really disappointed. So just making sure they are aware what these devices can and can't do, what their limitations are. For people who don't want surgery, I do the Ellacor. I do find that does a nice job tightening. Again, it's not surgery. So as long as people are aware of that. But yeah, anything that really can boost collagen, even out the complexion, I think that just goes so far, and not obsessing over every little line or wrinkle or creping, because I think that's where things can start to get weird and where people don't really look like themselves anymore.
And many people think that they're going to get filler and they're going to look puffy and overfilled, but that's a choice and that's a discussion you have with the injector. I really love that we're starting to think about and use more Sculptra hyperdilute radiesse to stimulate your own collagen. And that's especially good, I think, in people that are very thin, runners, my athletes, anybody who's lost a lot of weight on some of the medications they're going to encounter that facial volume loss. I have a picture of myself at 35, probably 30 pounds thinner, and my face was rounder. So it's a natural part of aging, but it's also going to be a natural part of seeing a lot of facial loss, fat loss with weight loss. But I think that's something that you can be helped with by a dermatologist.
Yeah, well, I love Sculptra and Radiesse. I'm glad you brought those up. I say it's playing like the long game, right? Start before you really, really, really think you need it, because that collagen is going to drop off dramatically after menopause, and kind of banking it as much as you can beforehand, maybe a vial a year, a vial every other year, just to help maintain. And again, great natural looking results. You still look like you, but you're just collagen banking. You're boosting that collagen because you know you're going to need it. And it doesn't prevent it from going away. It just helps you start out from a higher place. So the things to really prevent it, right? Like we talked about sunscreen. We know UV radiation is a big, really damages our collagen. Smoking, diet, exercise, sleep, like all of these things can factor in, right? Like lifestyle. It's just harder. We can't like package that in a pill form or topical, right? But all of that makes a huge impact too on your health and your skin health.
Absolutely.
Well, this has been a lot of fun. I would love to hear just like your top 3 pearls for someone listening who maybe is menopausal, postmenopausal, and wondering what they should do for their skin. What are your recommendations as a dermatologist?
Well, first and foremost, wear that sunscreen because that's always going to be your best anti aging cream. And then I think dedicate yourself to working with someone who's interested in helping you with your hormones to get you on hormone replacement. And then working with a dermatologist who can help you maximize the effects in your skin, whether it's something that you're trying to achieve with pigmentation, lines, or more moisture in your skin. And we can work with you with that too.
Yeah, go see the experts who know about menopause. Go see the experts who know about skin, and you'll get the best results without trial and error and suffering. Right. So great advice, Dr. Denman. I know people are going to want to find you, follow you, see where you're practicing. Can you share all those details with us?
Sure. They have lots of ways. Dermatopia was started because it was like you're a dermatologist anytime, anywhere. So it was the co-founding of the Dermatopia app with Christine Shanahan, Dr. Christine Shanahan. You can find me on Instagram, YouTube, and in person in Vienna, Virginia, and also with virtual visits.
Amazing. Well, I will definitely include all of that in the show notes, and I really appreciate it. I've learned a ton. Thanks so much for being here.
Thank you.